Somebody left a screw out. Fidget spinner kerfuffles, wrestling move whoopsies, and real-life fruit ninja? What? Today we're back at it, breaking down and reacting to some of the most popular YouTuber and other influencers' medical moments and unexpected injuries that were caught on camera. Please don't attempt any of these. Let's dive right in.
I'm gonna be doing fidget spinner versus my cheek like she did. Now I'm a little bit worried because it obviously messed, that.
Yeah, don't do that.
You can't do that.
Don't do any lacerations to your face. Yes, the face will actually heal better, but you're gonna have a scar on your face. No matter what, there is going to be a line there. No, it'll just stop. Thank goodness. It'll hurt and maybe cause a bruise, ecchymosis.
See how I was making fun of that girl for fidget spinning her face and it not looking real?
It's a decent amount of blood. Look at his shirt. He's got some blood on his right shoulder. Put a lot of pressure on it. If it continues to bleed a lot or there's a gap, you're probably going to need it closed. Many different ways to close it. You can use suture material or stitches. We typically won't use staples on a face because of the holes that makes.
I don't have a Band-Aid, so I'm gonna have to run to the store and buy a Band-Aid.
Put pressure on it. Get some sort of cloth, bandage, not a Band-Aid, but something to put pressure on it to soak a little bit up of the blood to get the bleeding to stop. If you put pressure on it long enough, it will actually stop. Whoa, that's a big rifle. It's not gonna be good. Gonna be thrown backwards. Oh! Somebody left a screw out. He's wearing safety glasses, thank goodness. I've seen plenty of eye injuries where people weren't wearing safety glasses.
So when I pulled the trigger, the gun exploded almost immediately. This cap hit me right there. The other ear hit me right here in the throat.
Wow. They stapled his neck shut. If somebody came in quite stable, I would sew this together. But this patient probably went into a trauma center, and because it's the neck, they probably had to do a very vital section of your neck where your major blood vessels are sitting right underneath there, plus the anterior structures like your vocal cords and your airway.
And then punctured a hole in my right lung.
The apical component of your lung does sit up that high. It could be from either a direct puncture, fractured rib, or just trauma to the area due to force. Obviously, he's got a splint on his nose, so he must have had a nasal fracture as well.
As for my hand, my best guess is this is what did it.
His splint goes all the way out to his fingers. That gives away that there's possibly a finger injury or a metacarpal injury because you want it all the way out so it doesn't move. Versus if it's just a wrist injury, it'll actually just come to this part of the hand. Oh, ow!
It's torn.
It might not be as bad as I thought, though. Yeah. Oh, yeah.
Oh! Just the fact the way that he's walking, the fact that he can't put pressure on it is not just related to the ligaments, but also the meniscus.
If I had to guess, I think it's
Which, ACL?
definitely your meniscus and the MCL. I think the ACL is too.
I did a triple whammy? That's great. At least I have this prime.
God, that's horrible. Terrible tryout is what we call that when the medial meniscus, the medial collateral ligament, and the ACL are all torn. And that's typically getting hit from the lateral aspect or the outside aspect of your knee. It kind of pops open.
Oh, that was pretty close.
Are we cutting fruit? It looks like we're cutting fruit. Oh, I see the red stuff. I like the 911 call immediately. Sit him down, calm him down, grab whatever you can to put compression to the area. You don't need to see what you cut. You need to stop the bleeding.
Oh my God! Oh, that was not a good idea.
Ooh. Finger's still intact, but you can see him shaking and he's dripping pretty good. The major blood vessels of your fingers are actually on each side of the finger. So if you hit that, you can actually hit a little arterial vessel and they'll bleed pretty quick and be dripping and cause a lot of discomfort. Plus, the nerves run right next to all the blood vessels, so you're gonna cause some pain.
Lance, come on, let's go. Let's go.
If you put the dry tissue on there, it's gonna stick to the wound. I would just wet it. Blood gets very sticky.
Is it sticky?
I don't know how to explain it. I'm like...
People definitely pass out with the sight of blood, with stress. I will say he is very much unlikely passing out from blood loss. You need to lose a lot of blood.
You can break a car window with your fist.
Don't do that. Don't do that. Oh my gosh. All I can think about is the amount of fractures that someone's gonna have in their hand. I mean, at least they're using something to protect their hand, but if they break the glass, it could shatter, could smack pieces of glass in your eye, and then you lose your eye. So please don't do this.
Here we go.
Oh, he's gonna lacerate his leg.
Oh, Oh.
Yep. Oh, there it is. On the medial aspect, high up there, that's when the femoral artery starts cruising down a little bit more deeper, but something to worry about, as well as the veins there. Gotta be super careful. The veins are much more superficial.
Let's pull the big piece off. Might need to go to the hospital. You gotta go to the urgent care. You're gonna need some stitches. Let's get you into the car.
So that's pretty good. He went to urgent care first. Some urgent cares can fix this, no problem. Some will send you to the emergency department. Urgent care is a fast track kind of business where people come in and out quickly.
Max getting stitches right now. That was a awful way to start the day.
Very good for the doctor. Very cool. He's got one of those camping headlights. Very useful.
That was a stupid thing to do. That was a stupid bit. And creating entertaining content, we sometimes get carried away. That is a lesson learned on getting carried away right there. Max is a trooper though. He said he wanted us to keep going.
Keep busting myths, boys.
Please, if you're busting myths, make sure you do it with safety precautions and understanding what the worst outcome could be. What did he do? He obviously didn't hit himself on anything outside of the mattress on the ground, but landed sideways and could also cause a little bit of shifting. Unlikely to cause a dislocation, but again, these are all things that you think of.
I think my back cracked. Ah! Oh, I think my back cracked.
Good sign is up walking around. The crack that he's describing is he thinks that he broke a bone. So your back can crack and make noises like going to a chiropractor's office. Typically, you have to have trauma to your back. My back! Not spinning, flipping, turning, twisting.
I swear to God, bro.
Lower back pain is like one of the #1 reasons why people can't work. If you do have a lot of pain, make sure you see your doctor. Make sure you go to the ER if it's an acute problem. Oi, missing.
Did it actually hit you?
Yeah.
Sorry.
Ah, see, I knew they were missing. Close hand fist to somebody's face. You can fracture your hand if you're hitting somebody's bony structures.
Bony all behind.
Try not to punch people in the face. People are not for hitting. Oh, he did smack him in the head.
I literally felt my nose crack sideways.
Did I break it?
And then I moved it back in the other direction.
At least it looks realistic.
Yes, you can snap the bone and you can push it back and you'll feel crunchiness, not fun. You will typically swell up and you will have blood go down each side because the laminae capricia, which is a type of bone in the middle, will actually fracture and the blood will seep down.
I'm gonna have an Owen Wilson nose now.
Wow. So these are good clips to react to. Hopefully you guys learned something of what to do and what not to do in certain circumstances when it comes to dangerous situations. Also, big new things on the horizon. Check out my brand new supplement company, Life Happens. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.